Adam Meakins, welcome to the show.
Thank you very much, Lewis. Thanks for the invite. Looking forward to the chat.
So we've got 5 myths lined up in physiotherapy. We're going to go through them one by one, but I'm sure we'll expand on them. So starting off with bad posture causes back pain.
Yeah, great topic to get started with because it's probably the most controversial one out there, I think. So bad posture is something, first of all, I think is a bit contentious in actually trying to describe what is good and what is bad posture to start off with, because there's a lot of disagreement there before we even get started about whether it causes an injury or causes pain. Is what do we mean by bad or good posture? And, you know, I think societally we all assume a bad posture is what your mother used to tell you were doing when you were a teenager. The slouched position, the slumped position. This is considered to be bad and dangerous and risky. I mean, I always remember my mum screaming at me when I'm sitting on the sofa saying, if you carry on sitting like that, you're going to stay like that. So I think that, you know, there's a societal sort of culture around posture that anything outside of the erect spine, the neutral spine curves that we should have is bad and dangerous and harmful and risky. But I just don't think it's that simple. I actually think, you know, there is, you know, a lot of, you know, nuance here about posture being risky and dangerous. But it's hard to challenge the beliefs and the societal expectations. I blame Disney a lot for it as well, Lewis.
Why Disney?
Because Disney as a childhood used to paint all the people with low morality, being untrustworthy, wicked and evil, as being hunched over and kyphotic. So again, I just think as a society, we assume the aesthetics of somebody's posture transfers over into their morality and their other attributes. And so I think that's another barrier to overcome with posture. Everybody thinks, you know, if you don't look nice, you aren't nice. And if you aren't nice, you're likely to be, say, at risk of injury or pain or disease.
Do you mind just giving a real quick description of what you mean by kyphotic, and probably at the other end of that, a lordosis as well?
Yeah, so we use these terms to describe curvatures in the spine. So our spine has these curvatures called lordosis and kyphosis. So lordosis is a curve that curves backwards, and then kyphosis is a curve that curves forwards. And our spine sort of goes through this S-shaped curve from the neck down to the pelvis, where we have a lordosis in the neck, a kyphosis in our thoracic spine, and then a lordosis in our lower spine. And the other term we sometimes use here, which again sometimes is related to posture, is scoliosis, which is a curve off to the side. So the curves that we just talked here are forwards and backwards, but you also got these lateral curves, scoliosis. And again, any deviation where the spine isn't dead straight and vertical is referred to as a scoliotic curve.
How much of that would be maybe bound to genetics?
I think a lot is genetically driven when it comes to our spinal curves. Exactly how much is very hard to determine. But, you know, it could be as high as 70% of the way that we are shaped is genetically predetermined. The environmental factors that, you know, we all go through our lives with our occupations, our sports, our hobbies, obviously do have an impact on our posture and our body. But I don't think they're as big as everybody thinks they are. So I actually think, as I say, a lot of the shape of our posture, our bones, is non-modifiable. It's genetic. It's something to say that is dictated by your parents. So you can blame your mum and dad a lot for your posture rather than your behaviours in your environment.
Have you come across Dr. Mike Israetel much?
I have, yes.
Online?
Yeah, I love Mike. Yeah, he's great.
He's probably at the moment my leading well, I say that he's my person I'm following at the moment, mainly because I'm going through hypertrophy phase as well. So I'm doing a bunch of hypertrophy work, and just the whole technical aspect, the tempo of lifting, because I've come from a sport where we built strength. We weren't necessarily trying to build size. I'm just doing this as more of like a personal experiment, trying to build size, see how that goes. As well as trying to build a little bit of strength, but most of my sport built around low reps, 3 to 6 range, get your maximal strength gains, It's very functional. You move into cricket, you do all your adaptive work, and that's it. But ever since watching him, like, one, his critiques are just hilarious. Like, he's just brilliant to watch. But there was one that I was watching around posture, and I think he was critiquing a men's health trainer or something like that, and talking about how this exercise is there to develop your posture, and he just kind of stops, and he's just like, look, the way to look after your posture is just to be attentive of it, right? It's to be very aware of what's going on, and then you can manipulate it through that attentiveness. It's not the fact that you're going to do a bunch of rear delt flies and then suddenly open up your chest, or just do massive stretching of your chest and open it up. And then the whole idea of us being on our devices, being on our phones, is there essentially what truth is there to that? But then is there an environmental factor, the fact that we are on our devices, we are sitting, we are maybe slouched a little bit more, that just gets us in the habitual nature of not being attentive to our posture?
Yeah, great question. And I think the answer there is, yes and no to various aspects of that. There's no doubt that our population has become more sedentary with, advances in technology and just the way society has been going. We are becoming less and less active, and that is detrimental to our health. Is it having a big impact on how we stand and how we sit regards to our posture compared to 100 or 200 years ago? I'd say unlikely. I'd say, there's other reasons that we are seeing increasing rates of, musculoskeletal injuries and pains and diseases is because of the lack of movement. The effect of that having on our body's composition and its position and its posture, I think, is not as big as everybody anticipates. And as you said there, our posture is governed by other things other than our muscles and our bones and our ligaments. As you said, you can change your posture very easily just by thinking about it. And, when you see these before and after photographs of people saying, these are the posture fixes, here's how, you spend 2 hours doing this type of exercise, or you do this particular type of treatment, and voila, your posture is magically correct. And you're like, get out of here. What's happened there is somebody's just decided to stand up straighter and pull their shoulder blades back a bit more. So I think, there absolutely is, sometimes a role for being attentive of your posture. Again, when it comes to, things hurting and aching, you can change how things feel very simply by changing your posture. But that doesn't mean that your posture is to blame for why you've got the pain in the first place, because that is just post hoc reasoning and post hoc thinking, which a lot of healthcare and a lot of trainers and a lot of therapists fall for. Just because something changes the perception of how it feels, it doesn't mean that thing was what's causing how it feels.
So it could be the posture, the posture related issues or diagnosis that people get is actually just the scapegoat for lack of movement, a sedentary lifestyle, athletic ability.
Absolutely. And I think also mental health. I think, when you look at posture, there is absolutely perhaps, some correlations here between how people stand, how people sit, with how they're feeling psychologically. So I think actually, sometimes when I scream posture, it's not just to see how muscles are functioning or what skeletal shape they have, but it's also how are they feeling in themselves? What's their mental health status? When people are, confident and feeling strong and robust, they tend to look that way in the way they stand and perform their movements. When somebody is unconfident, fearful, scared, in pain, just feeling low energy, they'll look completely different from a posture and how they perform the exercises as well. So I think, there is some role here for looking at people's posture, but just don't assume it's only about musculoskeletal factors.
I think anecdotally, I would say that I have seen athletes that have, and it's interesting you say that about the psychological factors of it, because, being in having, I guess, if we to wrap it in body language, athletic body language, so the traditional chest up, shoulders back, strong body language and looking confident. I have, in instances with athletes, I've seen, again, very anecdotally, a drop in ability in their skill set due to the rounding of the shoulders. Now, whether that is physical, whether that is environmental, or whether it's psychological, I don't know. It's hard to say for that individual. But I've got a good example of, say, a bowler that I work with in cricket. And I don't work too much with bowlers on their technical stuff. It's just this one lad I do. And he struggles to technically execute a certain skill set. And it's all in his wrist. So the wrist is where he's releasing the ball. It's the last point of call where he's letting go of the ball. And he's sort of internally rotating his wrist, especially if you're facing the palms facing forward. So it internally rotates. Almost the index finger leads towards the batter, which is not what you want. You want to have your little finger leading to get behind the ball. And I was looking at him and going, okay, we're trying to adjust his wrist, but it is just purely the fact that his shoulders, the fronts of his shoulders, his front delts, like everything is just so tight, and his chest is so tight and so rounded, because it's whether he's just been like that all day and he's just naturally habitually doing it, and it actually just impedes his physical ability to execute the skill that we're asking him to do. And again, I don't know whether it's psychological. I don't know whether it's what he's just not attentive to his posture. But there is an element of me thinking, okay, well, even if let's say he is say a little bit sad, a little bit anxious, rounded, but then everything else that he does just strengthens that ability to be in that posture, whether it's on his phone, sitting at school throughout the day. Everything is just promoting that rather than not promoting it. So it's I don't know. Where does that land for you?
Yeah, again, I think there's nuance here in those sort of, people that do have these performance issues that do change when you ask them to do something different with their posture or hold their body differently. I think sometimes it's just a different way of doing things. It's novel, it feels different, and sometimes that can be a mechanism of why things feels better. But, I hear this lot of argument about, modern society making us all a bit more kyphotic and rounded-shouldered because we're on our phones and mobile devices before. But I can guarantee that in the Victorian times, there were people sitting down, reading books, hunched over candlelight for hours and hours on end, probably just as much, as people are sitting on phones as well, So, there's lots of other factors, I think, that dictates how people feel, how they move, how they look, other than just the musculoskeletal system. And I just think we demonise posture way too much. I think we over-focus on it a lot, unnecessarily a lot of time. For me, when I'm seeing somebody with a pain or an injury, posture comes way down on the list of things that I'm looking for, in things that, could be contributing to how they feel, why they've got pain, and how we can try to address it to make things feel better. I'm not going to say it's not on my list of things to address, but it's just, it's well behind other factors.
So if we're talking about back pain here, what are the first places that you look to address when someone does have back pain, whether it's chronic or acute?
Yeah, well, I think, there is a difference between acute back pain and chronic back pain. So acute back pain has a very favourable natural history. So a lot of the time we just know it just needs time just to ease out over a few weeks and just try to keep people moving and active. But when it gets into the chronic stages, when it hasn't followed that sort of natural history, then we have to look into other things. And, I do start off with lifestyle, behaviour, beliefs and expectations. Those are the key variables that I find absolutely do impact on people's musculoskeletal problems hugely, and they're completely unaware of it because they always think it's about their abdominal muscles not firing correctly or their posture's too bad, when actually they've got shitloads of stress going on in their life at the moment. They're not sleeping well, they're not active, they're not engaging in meaningful physical activity, they've got relationship problems going on, social economical variables and factors as well that are also contributing. And so it's just sometimes just making patients and people with pain aware of these things and just saying, these variables are also things to try to look at and adjust to help your body feel better. It's not just about activation of muscles and changing posture.
What do you mean by beliefs and expectations?
Oh, that's a great one. So again, societally, the beliefs and expectations often, when you've got back pain means, people just think it's because they are doing something wrong. Particularly when you get into the chronic situation, they're either, sitting wrong, they're not using the right muscles and things along those lines, and just trying to unpick that from people's minds by changing and giving them a more positive outlook on their body, showing them and explaining to them how bodies are much more resilient and robust than they think they are, how there's a lot of variation, how, it's very hard to say that this is bad and this is good based on lots of things. And also, beliefs and expectations of recovery and outcome are a huge predictor of their outcome. So, we know when patients don't feel like they can get better, they've lost hope, they've been given lots of negative information of low chances of success, that's a huge barrier to overcome. The body often follows where the mind goes. And if the mind isn't going in a good place, the body tends to go with it as well. And so a lot of the job of a good physio is to try and understand where the patient's mindset is and try to, if it isn't going in the way that is going to help them improve, try to see if we can change that, give them some positivity, give them some optimism around their body, give them some, belief that things can be improvable. There is light at the end of the tunnel. But that's not always easy to achieve.
That's so interesting, because I went through a period at the end of midway through last year, where I really struggled with my back. Now, I've had a history with my back, like I've multiple stress fractures in different vertebrae, so discs bulged just through sport, and that's just my start of the list. But last year, I had been pretty good since I retired. And then I changed, having come back out of lockdown from Australia, and then I was sort of doing more home workout-based stuff with like a lot of dumbbells, and I had my yoga practice that was really, really beneficial for me. One, for the awareness of my back, but then it just started to get worse. And I was thinking, what am I doing? Like, what am I not attending to here? And 100% it was my psychological health. It was purely from that. I wasn't in a good place. I was sort of kidding to myself of where I was at. The way I described it, I was functionally depressed, and I was presenting a version of myself that was not what I actually felt internally. And from that, I felt changes in my body to this chronic pain. It went from just being something that I thought was going to shift, and I was kidding myself saying it's going to shift, it happens, this is part of my life. And as well, with my condition, I have to consider that I do have pains that happen on a daily basis, but I had said to myself, no, it's going to shift, and I was just kidding myself. And psychologically, I'd built myself into this physical hole. And it's so interesting that you can really do that. And from a physio's point of view, it must be incredibly hard to convince people to see that different side of things, because they're coming in pain. It's like the world is ending, and that is your physical pain does create a negative psychological effect, because you just see the world through this pain covered eyes, these sort of pain tinted eyes, essentially. So that's not easy what you're talking about. It can't be, because I think about every time I've been injured or had pain, you're going onto the bed and you're like, please just fix this, because this physical pain is so intense.
Yeah, well, what you said there is pretty much hit the nail on the head. Societally wise, physiotherapy has a reputation for fixing things. You go and see the physio and they will fix your problem. They will cure you. They'll make it better. But it just isn't that easy. Physios don't do anything magical. We don't fix things. We don't cure things. We try to, again, diagnose. We try to separate the serious from the not so serious. That's a key fundamental role of what we do. That's the first priority, really. Is this shit serious? Do we need to do other things other than physiotherapy management for it? And then, what we try to do after we've cleared all that seriousness out, hopefully, which is very low and rare occurring, is try to work with people to restore their confidence, to get them, back into doing things that perhaps they didn't think they could do. Try to, gradually expose them to doing stuff that they thought was dangerous and harmful. Give them the belief, the optimism of recovery is possible. And as you said, it isn't an easy task when people have got mindsets that have been poisoned by other people out there. I very much have a little heart sink moment when I ask a patient, okay, how many other therapists have you seen before you've decided to come and have a consultation with me? And I get this, I've seen 5 or 6 other people before. And I'm like, yeah, okay, right. Because I just know this person now has probably got lots of conflicting information from these 5 and 6 other people. And I'm sure some of it's going to be complete and utter bullshit. And I've now got to try and help that person and work through this confusion and complexity and contradiction. And yeah, it can be quite frustrating for me and any evidence-based therapist out there as well, because our profession is struggling to find, just the common sense, simple, rational approach to helping people with pain. We always overcomplicate the shit out of everything. And it acts as a barrier. It actually makes people, as you say, they just get stuck and they get, don't know what to do, don't know how to do, so they do nothing. So it's just trying to get people to focus on the big rocks, look at the bigger picture, and try to, again, guide, support, encourage and motivate rather than fix and cure.
On the other end of the spine, so we've sort of quickly talked about kyphosis, but I want to just touch on lordosis, because for females especially, it's a promoted curvature in society, I think, at the moment, right?
Booty,
it's the big booty, right? Yeah. So have you seen the fact that females promoting that, does excessively promoting that cause injury? Can it cause concern for whether it's injury or even performance?
That's a great question. And if I'm being honest, I don't actually know. I personally haven't seen a influx of females with back pain because they are stuck in excessive lordosis. If I'm being honest, I'm still seeing the opposite more in patients who are told you got to avoid flexion. Flexion of the lumbar spine is bad. Slouching, tilting the pelvis posteriorly. These are the things that are considered to be bad, particularly for, the risk of your discs, your disc health, because again, if you go into flexion under load, it's thought to cause posterior disc herniations, which again is just simplistic, reductionist, utter nonsense. But, so it is a great question with this culture now of people sticking their bums out, trying to, do the old Instagram poses. We're now encouraging much more lumbar lordosis. Are we going to see increases in back pain because people are going that way rather than going in flexion? Great question. I don't know is the answer.
I only say that because I've got a couple of friends, females, who I've gone to the gym with recently and kind of actually introduced them to a little bit of Mike Israel training and just getting like full range of motion, but then going into their goal, ironically, is to grow their bums. And as a bowler in cricket, we have traditionally big arses, right? We have big bums. I think my daily diet was hip thrusts, and it was just load up your glutes to protect your back, and it was, but you gain your power from that and things like that. So you see baseball pitchers have them, and us in cricket, it's just our big arses that we have. But they're always in search for that. From an aesthetics point of view, and they have, I just give them a couple of like ab exercises and they're incredibly weak, and I just think that they've kind of neglected that side, the core and even hip flexors to literally constantly stick their bums out, and they're very attentive to it, very, very attentive to it, because the Instagram pictures demand it.
Absolutely, culture demands it.
Yeah, so let's move on to myth number 2, which is one that I saw you doing a little bit of not too long ago, which is deadlift is causing injury.
Yeah, so again, another common misconception that, lifting heavy loads up and down off the floor is perhaps one of the most dangerous and risky type of exercises that you can do. I've heard people talking about orthopedic risk and reward, or orthopedic cost is a term that I've heard being mentioned here. So deadlifts are considered to have high orthopedic cost compared to other types of exercises, which potentially could be safer, because again, this notion of that when you bend over and you pick up a heavy load, it's going to, if you're not in the correct position, if you're not in a neutral spine, it's going to increase your risk of injury and pain, particularly in your lower back. And there's just no evidence to support that at all. If anything, there's evidence to actually say that lifting weights is probably one of the safest type of sports that you could do, or in activities that you could engage in. I try to quash this myth as soon as I hear it, as often as I can, by presenting some data that we've got, the statistics of injuries in various different sports, to show how safe weightlifting, powerlifting is compared to other things like football, cricket and rugby. So we often, look at prevalence of injury rates per 1,000 hours of exposure, and we've got quite a lot of data out there. And when you look at the number of injuries per 1,000 hours of exposure with things like weightlifting and powerlifting, you're talking single digits. Sometimes it's as low as 1 per 1,000 hours of exposure. sometimes up to 3 or 4 per 1,000 hours of exposure. Got any idea how much it is in running, Lewis? How many injuries happen per 1,000 hours of running exposure?
Oh, I was going to shoot for 200.
Not quite that high.
Oh, God, I was going to say like.
So it is high. So running is about 44 injuries per 1,000.
These are injuries. Sorry, these are total injuries.
Yeah.
Yeah. Fair enough. Yeah.
44 injuries per 1,000 on average in running. And running's considered to be one of the safest type of exercises to do. You know, when people are told you've got to get fit, what do they think they're going to do? Go and do deadlifts or go for a 5K run out in the street. So I tried to get people to understand that running comes with, you know, injury risks that are a lot higher than doing weightlifting. What about cricket?
Sport
Do you know
based,
what the
right?
injury rate in cricket is?
But that's just literally going for a jog, doing like your 5K, 10Ks. That's completely linear running.
Yep, that's just normal road running. That is just normal recreational running that people would do. 44 injuries per 1,000 hours of exposure compared to the 1 to 4 injuries that would occur if you were to go and lift weights.
Cricket, I would say, this is hard to say because I feel like everyone's getting injured in cricket at a certain level, but this is probably also, I'm going to assume it's lower, sort of around, it's higher.
Yeah, it's higher than running. Yeah, so this covers recreational and professional cricket.
Then 50 to 60.
Yeah, 71 injuries per 1,000 hours of exposure.
Wow.
And then rugby is one of the highest, no surprises there because of the contact sport, but that's over 80 injuries per 1,000 hours of exposure.
Yeah. Oh, that's interesting. That's why cricket is, I actually find a really interesting one because there's a lot of people that when I talk to them about it, say how many injuries I get, and they're like, wow, you must have been hit so many times. I'm like, nope, all self-inflicted. So no one touched me whatsoever. I think I maybe tore a quad once after I'd been struck by a 90-mile-an-hour bowler on the thigh and it missed all my padding. And then I think I did a quad probably like later on, and that's actually a genuine concern that you have in cricket. Like you get hit by a projectile, right, and it's bruised. But the sport is that you have to go again. You either have to do it later on that day, and your muscles are physically damaged, and you've got to try and perform at a high level. That's something that people don't consider. But you're not getting hit by anyone like in rugby. So those are wild stats.
Yeah, and I think they're quite surprising as for a lot of people when we try to explain that, you know, and try to quash this myth about lifting weights. Because when people go to gyms, you know, they are doing it normally, you know, with consideration, with care. They've got a lot of control over what they're doing, you know. So people, again, tend to be erring on the side of caution, particularly if they're a novice. They're going to go in, they're going to start lightly, they're going to progressively adapt things, which is the way it should go. That's what keeps things safe. What happens when people go out for a run, you know, they'll go and do too much too quick. They totally overestimate how far they think they can run. They haven't run for the last 15 years and they'll go and think I can do a 5K immediately. And then surprised why their Achilles tendon blows up and then stops them from running for the next 3 months afterwards. Or you got a sport like cricket, as I say, which is done normally over longer durations. You know, you could be out there for hours on the field and there's periods of standing around, waiting, and then high explosive sudden movements that are a lot out of your control. And you say you've got flying projectiles as well to also take into account. So I say to people, you know, all activity, all exercise is good. I don't want to put people off, you know, I don't want to start saying don't go and do these things. But you just got to recognise there's risk in everything we do. But don't think lifting heavy weights is the riskier thing out of all the sports and activities you do, because that's just not. So that's something I try to help people understand. Deadlifting, not a risky activity at all.
And they help your ability to do the other things better.
Absolutely.
I don't think I've ever injured myself deadlifting, not considering, because there's a limitation, right? When you're running, you almost don't have, there's nothing really pulling you back other than the fact that you'll gas out if you're going too fast for too long, or let's say you're running down a hill, like you're just going to go at that velocity that you potentially can maintain, but that might exceed your physical ability and what your muscles are used to. But if you go to pick up a too heavy deadlift, and if you're untrained, like there is a limit. Like as soon as you get to that point of no return where I can't lift this anymore, no matter how much I try, I'm done, and I can't. So the weight itself can mitigate that ability to injure yourself to some degree.
It's self-limiting. So I think, you know, the fact that we don't see back injuries in deadlifting a lot in the novice lifter. We actually see it more in the more experienced lifter. It tells us that, it's the experienced lifters who tend to push their boundaries too far. All injuries are simply, forces exceeding our tissue's capacity. And, to be able to do that in a sudden singular exposure, like lifting a big heavy weight, requires a lot of ability, skill, confidence to do. Novice lifters don't have that. More experienced lifters have that. So they are likely to flirt with their tissue capacity. They're likely to push their 1 rep maxes to the absolute limit. Whereas a novice wouldn't do that. But in running, your tissue capacity is exceeded gradually, slowly over longer durations. It's a lot harder to know where that boundary is. So we see more injuries in the novices in running, whereas we see experienced people that actually know what their tissues are able to do. They've learned through experience. And normally it's because they've had previous injuries before. So they learn from that and they actually start to, understand where their tissues are capable of tolerating their long runs or not.
Mm. Where do you think weak core causing injury and pain comes from as a myth?
I think that's a lot of Pilates' fault, if I'm being honest. So Pilates is a key intervention for back pain, and Pilates has this association with a lot of abdominal strengthening, core strengthening. But I don't actually think Pilates strengthens the core much at all. I think it helps a lot of people with back pain, absolutely. And there's evidence to say that it is a good option when people have back pain to go and do some Pilates. But it isn't because their core is getting stronger. The amounts of forces and the activity and the duration they do just is not enough to create any physiological changes to their core trunk musculature. Now, I know I'm going to probably piss off a lot of Pilates experts out there who'll be screaming at me going, "Oh, you haven't done a Pilates session with me. You don't know how hard and tough Pilates can be." Yes, okay, I know some Pilates sessions, advanced Pilates, if you want to call it that, can be quite tough. But in rehab settings, with people with back pain, there's absolutely no way the forces and the exercises they're doing is in any way, shape or form getting their abdominal muscles stronger, but it helps their back pain. They feel great afterwards. So there's other mechanisms, there's other mediators as to why Pilates helps people with back pain. It isn't because they had a weak core and it's got stronger since they've done Pilates.
Do you think those mediators are the range of movement, they're the positions they're getting into, they're different, it's a psychological or placebo effect potentially happening as well?
Absolutely. I think the biggest thing that helps people with Pilates is the belief and expectation it's going to help them. It has a very strong positive narrative. It has this now reputation of being the thing to do when you've got back pain. You go and see a specialist who will again give lots of positivity around the Pilates. There's this illusion of specificity about how you're targeting these individual little muscles. Your transverse abdominis, your pyramidalis is being activated to 13.5% of MVIC and all this sort of nonsense. So I think all that adds, this strong positive placebo contextual effect to somebody doing Pilates exercises. And it's just getting them moving. It is getting them to do things that they haven't done and do it in a different way. So I think that's also another mechanism.
I think there was a definite part of that for me with doing yoga mainly, and I've had Dan Van Zandt, and we've spoken about Dan over text, and Dan was really interesting because I think he just really demystifies a lot of the flexibility myths out there and clarifies what it really means and the actual terminologies that can be used and sort of where everything sits. And really interestingly, he was quite a big fan of just yoga purely from getting yourself to start the ability to stretch tissues, to stretch everything from a passive, static point of view. So to start there, he found it really beneficial. And that's, for me, it was the most beneficial. But linking in with the mindfulness part of that practice as an athlete to gain a better understanding and awareness of how your body feels, for me, had actually attributed to a lot of catching injuries before they happened. So I was able to have a better understanding of my body, how it felt, because I was spending more time tuning into my body, whether it was through, okay, what's the difference between something that needs stretching, something that's painful, what's a niggle, what's actually a pain and an injury that I probably need to go and see something about. And that came from, I guess, going into that experience, knowing there was going to be some form of psychological help to go along with it. So I think, as you said earlier, this element of if it psychologically is changing you, it could actually have that physical impact. It's very, very interesting that's come up.
Yeah, no, I think as say, if you give a good, strong, positive narrative around a treatment, we know it has a strong positive effect on the person's outcome of that treatment, because the power of the mind is so strong. These contextual effects that I just keep mentioning all the time are probably one of the biggest reasons why a lot of our therapy type treatments help people. The specific effects of the treatment, I think, are very, very small. So if you can paint a positive picture, convince somebody this is the best thing for them to do, they absolutely will get a good outcome from it as well. And again, I just think, there is a benefit of getting people doing something different that they haven't done. I think a lot of people just get stuck into these movement ruts, into these lifestyle ruts, and a period of time of doing something different, challenging your body in a different way, putting different sensations into it is great. So if I see runners, I'm very rarely telling a runner to run more when they've got an injury. I'm telling them to do something completely different. It's normally heavy, slow strength stretching, strength training. But if I'm seeing somebody who's in the gym and doing heavy bloody loads and heavy weights, I'm not telling them to carry on doing heavy weights. I'm probably telling them to go out for a run and do a bit of cardio. Definition of madness is doing the same thing and expecting different results. So that's often where people get stuck into when it comes to their bodies and their problems and their injuries. So it's just sometimes highlighting that to people, giving them some confidence that it's good to do with a positive narrative and a story around it. Off they go. A couple of months of doing it, starts to feel good.
Muscle imbalances causing injury. Talk to me about
that. Yeah, another big myth again around injuries and problems where we got to have everything in perfect ratios. You got to make sure one muscle isn't stronger than another one. So I hear this all the time, and it is a bit frustrating and annoying. But I can sort of understand where it comes from, because there is some research out there that says, these are things to keep an eye out for, or we see these injuries more if they have these problems with their ratios. But the problem with ratios of muscles is it doesn't give you any indication of how strong or robust somebody is. That's the biggest problem we see with these muscle imbalance ratios. So just because somebody has the perfect ratio between their hamstrings and their quadriceps, it doesn't tell you how strong their hamstrings or quadriceps are. And I think it's more the factor that we're looking at how robust and strong the muscles are rather than the actual ratios between them.
Right. So is that you're talking about size? They're measuring size or
force output. So it's normally measured sort of isokinetically or isometrically. So we put people on these dynamometers, ask them to push against something, record how much force they can generate. And then we say, looking at how strong your quads are, we expect to see your hamstrings now to be 66% of the forces that your quadriceps can produce. So this was the golden figure that was thought to help ensure that your hamstrings were not going to get injured. You needed to have a 66% ratio of the strength your hamstrings could produce compared to your quadriceps. It just doesn't hold up at all. It's just simply not that easy. Because if you've got weak quads, and you then get this perfect 66% ratio, you still got weak hamstrings. And it's the weakness that causes the risk of injury rather than the actual ratio. So, and I've seen it in the shoulder. Shoulder is an area of specialism and interest of mine. We have this internal-external ratio, again, isometrically around the shoulder. And again, roughly about the same as the hamstring quad ratio. We think that your external rotators, if you're a throwing athlete, need to be about 70% compared to the power of your internal rotators. So your internal rotators are the ones that bring you into this throwing motion. They actually cause your hand to come forward as you release the ball. And obviously your external rotators bring your hand back into the cocking phase of throwing. So again, there was a lot of research around what is the ideal ratio of the forces produced by your external and internal rotators. And the theory was here, again, if you've got two strong accelerators, your internal rotators when you're throwing, and your external rotators, which are your decelerators, can't keep up, then that is going to increase your risk of injury. But again, it just hasn't held up very well at all. So these ratios very rarely give us any good, reliable injury risk prediction. So muscle imbalances are, something that just, again, talked a lot about, had a lot of research on, but just doesn't seem to stand up. And we're all, the thing is the other thing to consider is that everybody is imbalanced. Humans are not perfectly symmetrical. If you are, doing a sport like throwing, your throwing arm is going to be completely different than your non-throwing arm. And that's the other thing we look at when it comes to imbalances, the asymmetry between left and right. Is your right leg exactly like your left leg? Is your right arm exactly like your left arm? I just don't understand it. Even in symmetrical sports, even in sports like sprinting and Olympic lifting, we see asymmetry. It's roughly about 10 to 15%. Your dominant side tends to be 10 to 15% stronger than your non-dominant side. That just seems to be a normal variation. Now, obviously, if you do something that's asymmetrical, that asymmetry is going to be even bigger. And it's actually advantageous. I think, there are some studies out there that show actually being more asymmetrical in certain asymmetrical sports is a good thing to achieve. Cricket bowling being the classic example.
Yeah, I mean, I have such an asymmetry, but I'm naturally born with it. So I don't know if you know much about my condition. So
Poland syndrome, wasn't it?
Yeah. So I'm naturally imbalanced in my body. I'm completely asymmetrical, and I don't have a choice. Like that is what it is. But I play an asymmetrical. Yeah, well, it's not actually. It's not. It's random. It's not passed down. It's just a random thing, right? It's just. It's not. It's totally random. And playing an asymmetrical sport, yes, being left-handed, there's so many. I think it's hard to say whether any of my injuries were caused by those imbalances because they are so they're so exaggerated from my body. Like I'm almost physically 3 kilos heavier on my left side than I am on my right. You can almost see it. It's like this guy's bigger on his left side, and so the asymmetrical forces that I'm creating, and I've always just had these imbalances and being able to have to be aware of them. Yes, it's challenging, but it's not stopped me from doing the sport. And some of the injuries that I got are no different from someone who is totally symmetrical that you would look in traditional sense. And so I think for me, it's always been come down to you just make the best of what you've got. You just make the best of what you're working with. I've always looked at someone like Nadal, right? Nadal, he's considerably bigger on his left side or right side. I can't remember which. Is he left-handed?
I think he might be left-handed, yeah.
Yeah, so his left side is considerably stronger. And yeah, it's not been a bad thing for him. It's worked for him.
No, I think, again, we sometimes get a little bit, simplistic in our thinking about asymmetry. We think everything should be balanced and equal from left to right, front to back, and it's just not that simple because human bodies are not machines. We are biological entities, and nothing in nature, nothing in biology is symmetrical. It's going to be wonky, it's going to be tilty, and things are robust and adaptable despite the asymmetries. Sometimes the strongest trees are the ones that are more twisted and gnarled and crooked, and it can be the same with human beings as well. And sometimes it's the processes of making things twisted and crooked that makes them stronger. So I think, it's a process that, can be adaptive and it can be beneficial. So, if you're looking at a thrower, from a young age, that gradual exposure to doing things with their throwing arm that the non-throwing arm has is going to change the tissues, the physiology, the muscle on that throwing arm compared to the non-throwing arm. And as I said, it's going to be beneficial a lot of the time. Very rarely do I look at somebody and say, I think that asymmetry is problematic. It's a disadvantage. Very rarely.
Mm-hmm. So last one, how you move and do exercise predicts your injury risk.
Yeah, so coaches and physios like to do this. They like to observe somebody exercising and say, stop, don't do that. You're going to hurt yourself. You're going to get a problem. And again, just not that simple. So if we were to take the deadlift, the classic one is going into lumbar flexion, curving the spine as you go down and pick up the weight. And that is thought to be, again, risky and dangerous compared to keeping your spine in this lordosis or more neutral position. But there's absolutely zero evidence that people get back pain more when they lift with flex spines compared to neutral spines. So there is this belief, and again, I think it's societally driven. I think it's driven by culture that, you've got to keep your back neutral, perfectly pristine looking when you lift. But we know in reality that just doesn't happen. You only have to go to countries like Asia and see people working in the fish markets, in the fields, see them bent over in positions that would make your mother's eyes water. And they are perfectly okay. They're doing these tasks and activities. I'm not going to say they do it completely without pain, but do they get any more pain than somebody who would be doing something in perfect neutral alignment? Probably not. So again, I just think we got to recognize the remarkable adaptability of the human being to be able to perform tasks and activities in various different ways. Just how an exercise looks doesn't give us any good predictive information about whether it's dangerous or risky. Observable feedback is very, very low quality feedback. What is actually better feedback to get when somebody is exercising or doing a task and activity is to get their feedback, their internal feedback of how it feels as they're doing it. That's so much more useful for a coach or a physio or a trainer to use to help somebody perform or do an exercise better and safer, not just based on what it looks like.
I always think the one that I first saw when people like kicking off was the Jefferson curl.
Yeah.
Are you a fan of the Jefferson curl?
I love Jefferson curls. I try to do them perhaps once a week myself, and they're glorious. They just make my back feel amazing. And they've got such a bad reputation. I don't understand. I do them with about 100 kilos as well because I really love doing them heavy.
So are you doing them for strengthening, or are you doing them for more?
No, I normally do them as a way just to make my back feel better, less stiff and tight. So I just like to do this more heavy, slow exposure just for a low amount of reps, a couple of sets of once a week, just to give my back a different stimulus to try and make it feel more, loose and flexible. I call it strength stretching, basically. I've talked about this with Dan before. It's just putting tissues under load through slow movements that just create them to lengthen eccentrically.
I was going to say, are you only doing it eccentrically?
Yeah.
And then are you, at the very bottom, are you dropping the weight, coming up?
No, sorry, I do the concentric phase as well. So
Will you? Okay.
Yeah, I do lift
but
it
you're
back.
spending a lot more time on the eccentric.
The time under tension going down, the eccentric phase is probably, 3 or 4 times the length of the concentric phase. Yeah.
Yeah, just because how that exercise looked, it's quite literally the opposite to that cultural norm of having that straight back and everything's got to be perfect. And I remember when I first saw it, I was like, this is interesting. Did it, and I was like, wow, I feel amazing.
Well, I think that's another benefit of doing Jefferson curls because you get this expectation violation. Everybody thinks it's going to be the worst thing. It's going to be painful. It's going to be dangerous. And 99% of people who I give Jefferson curls to, you see their eyes go. They got this surprised look on their face that goes, "That feels fucking amazing. That feels great. Why have I never done this for 55 years of my life before?" Because you've been told to live in neutral. You've been told to avoid flexion. You've been told that's dangerous. So you've never had any exposure to it. You've never had the chance to put your tissues through this glorious amount of tension and movement that they're just dying out for.
Yeah. So what are your thoughts on sort of remedies and therapies such as your acupunctures, foam rolling and massage guns? I'll probably bundle them all in together.
Yeah, the passive adjuncts, as I call them, the things that somebody else is doing to you rather than your active adjuncts and treatments where you're doing them themselves. I think, they are the feel-good treatments. They are things that can make people feel nice afterwards. But are they adding anything significant above and beyond anything else than time and active treatments would do? I don't think so. I think they're over-promoted. They're overhyped, they're overused, and sometimes I think that's detrimental. I think it takes away time, attention, focus on things that are probably more beneficial to be doing other than getting a massage, a bit of acupuncture, a laser treatment, or a bit of cupping put on you. Those 20 or 30 minutes you're getting that, paying how many pounds, I don't know, probably 50 quid to have that. That time and money would be much better spent once or twice a week doing other things personally. And again, I get a lot of hate for this. A lot of therapists don't like me promoting this message and talking about this. And I get it, it's when people have spent a lot of time with these interventions, they do attach their identities to them. And they do. And I'm not going to say they don't do anything. That's a common misconception. They are there as feel-good treatments. And if people have the time and the enthusiasm and the money to do it, on top of the other stuff, knock yourself out, go for it. Nothing wrong with it. They have low risks and harms. The only harms that I think come with them is the explanations and the bullshit about what they're doing, releasing the fascia, removing a trigger point and all that sort of crap. So these feel-good treatments are thought to be very specific and doing very skilled, specialized things. And again, therapists hate this when I talk about it, and I say, no, it's not. You could train a bloody monkey to do cupping, all right? There's no specific skill behind it. So it's just something that, just does something. It plays around with somebody's perceptions, neurophysiology, neuromodulation, and it just makes something that felt a bit stiff and tight feel different for a short period of time.
I guess there's a little bit to what we've been talking about as to this kind of, not with some of those things, not placebo effects. So I actually have a Theragun. I actually use it as a little bit of priming for when I'm about to play, but it's again, purely feel good, because it's not I do that and that's my warm up. It's I do that and it gives me the ability to feel better, to go and do my warm up, to do my stretching, to get into my yoga, to whatever it might be, right? And I guess there's some of what we're saying is that if it works, even if there's necessarily not something that's backing it through the literature, is it a bad thing?
No, absolutely not. I think, there's lots of uncertainties and unknowns in a lot of healthcare. We don't know why this is helping people, what the mechanisms of effect are. All we've got to be careful of is it doing harm? Is it giving people false ideas and false beliefs? And I do see it sometimes. I do see some patients, they get addicted to these treatments, particularly things like manipulations. They go and get their pelvis clicked or their upper back, cracked. And I sometimes call them the crack addicts, because they're like, I need this every week. Need to get it clicked back into place. And I'm like, what do you mean back into place? Well, I was told it's because this vertebrae is shifted by a millimetre and the click is pushing it back in. I'm like, that's complete and utter bullshit. All you're doing is you're just putting forces into a joint, creating a cavitation in that joint, and that gives you the popping sensation. What that does, we still don't know. This belief about creating a gas bubble in the joint to stretch out and change the dynamics and all that sort of stuff still hasn't been well established. So the mechanisms of how a manipulation helps the pain feel better for people is still uncertain. So I just say, it feels nice, but it isn't because it's pushing things back into place. Because I think that's a shitty narrative for somebody to think that every time they get a pain, they think their body is that fragile and unstable, something's moved out of place and they need to go and get it pushed back in. That's a shitty belief to have, to go through the rest of your life feeling that fragile about your body.
Yeah, I think that actually leads on to something that we spoke about just before we started, which is this concept or the conversation around injury anxiety. And I only bring this up because I actually feel this. If I really am honest and tune into what I've experienced in my 34 years on the planet, and especially as an athlete from professional to amateur, I feel injury anxiety quite a lot. I feel nervous sometimes about the fact that because I've had so many injuries that I potentially could get another injury, and this could be a moment where something happens. And with that, I have looked back at games I've played, and there's so many games where I wasn't present to execute the skill because I was so in my body, worried about what would happen to it, that I wasn't actually thinking about executing the skill and performing in what I was doing. So I've had conversations with young athletes, especially who are coming back from injury. How do we come back from an injury with confidence and without this injury anxiety that can riddle us?
So the first thing to say here is that it's a perfectly normal, natural feeling to be like this after an injury. And I think the first thing we've got to do is recognise it and accept it and normalise it. It is perfectly okay to have fear and mistrust in your body after it's let you down and given you an injury. I've had it myself. When I injured my disc 2-3 years ago doing deadlifting, going back to doing the deadlift weight that injured me took a long time for me to feel happy and confident to do that. I'm talking years. I was back deadlifting within a couple of months, but to have the confidence and not to have these little whispers in the back of my mind going, danger, 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 watch out, watch out, watch out, took years to disappear. So I think, how can we help that is to first normalise it, say it's okay, let's talk about it, let's get it out in the open, let's not be ashamed of it, let's not make us feel that it's something we have to hide and pretend isn't there, because I don't think that's helpful. And then the next thing to do is recognise it just takes time for it to go away, but it goes away with repeated gradual exposure to the thing that brings it on. So you have to keep doing the stuff that makes you feel uncomfortable. You have to do the stuff that makes these fears and these anxieties present. And you just have to chip away at it by gradual exposure and eventually prove to yourself and to your body and to the system it's okay. Nothing bad has happened. But the risk is that if something bad does happen as you're doing that, it's going to add to those anxieties again the next time. And then it's going to have to restart it all over again, which is sometimes what does happen with repeated injuries. So I think the more injuries you have, the higher these things unfortunately tend to be and the longer they take to disappear. And there is no quick fix. There is no magic solution here. It is something that just needs to be normalized, recognized as perfectly okay, and then just worked with rather than trying to just get rid of.
It's with anything, like anything that you have where you've had some form of anxiety. It could even be a bad performance that you've had. You've got to literally, you can't run from it. I think we're falling into a trap of mentally trying to sugarcoat too many things for people to protect to protect ourselves from these dangers, because I get people saying, how do I get rid of my anxiety? And it's like, well, by literally facing whatever's making you anxious and dealing with that, rather than thinking I need to move away from this thing that's making me anxious. Because especially if we're talking about sport, it's something that you enjoy doing, you're going to get yourself in an uncomfortable position, whether it's in a performance or whether it's physically coming back from an injury that you're trying to expose yourself out of. And yeah, the only way out of anxious feeling is through it.
Yeah, I think sometimes we've got to lean into these things, and it just needs that, little graded, gradual exposure approach. We're not talking gung-ho. We're not talking, really aggressive, uncomfortable situations. It's just about chipping away it literally, gradually, slowly to try and just change things, and its perceptions. But I also think, it's just getting rid of this toxic mentality about positivism all the time and about how things have to be perfect. And if you've got something that's not perfect, then it's your fault. And it's something that's adverse, and something that we use this term a lot in physio called yellow flags. I hate it. It's this term that we sometimes, physios like to attach to people, saying they've got these adverse behaviors outside of normal behaviors, which means they're not going to have good outcomes and stuff like that. I'm like, this is all bollocks. This is just stuff that happens to people when they've got injuries. They ruminate, they focus on it, they get stuck on it, they don't know how to proceed, they got fear and anxiety. It's all perfectly normal, human, natural behavior to have.
Interesting. Is there, just as we come towards the end here, really, what, I know there's probably loads of things here with this question, but is there anything that you once held to be true that you've now changed your perspective on?
Where to start? In my 20 years as a physiotherapist, I was taught and believed many, many things that have just turned out not to be true. I've mentioned half a dozen already throughout this podcast about joints being out of place or manipulations, cavitating joints. But, recently I think, the one that has sort of shifted my, focus quite a lot is, work spent or time spent doing mobility work, flexibility work. I always put this as a very low priority for everybody, but I actually think that was a bit too strong a stance to take. So I do think, for some people, absolutely, they do benefit a lot more from spending some time taking their body through various ranges of movement under various forces and tension to create some really good, positive, beneficial adaptations. So I had a bit of an anti-stretching stance. I thought it was a waste of time. You didn't have to bother doing it. It was all about strength and hypertrophy and power and endurance and cardiovascular. If you got 30 minutes to exercise, don't spend it doing yoga. Don't spend it doing mobility work. Go out for a run. Go and do a few push-ups. I've changed my thoughts on that now. I've realised you've been a bit of a knobhead here, Adam. You're letting your own biases, in your own preferences, dictate what you're telling other people to do. And I sort of wound my neck in quite a lot there and said, you know what? There are people out there that absolutely do need to spend 30 minutes down on the floor, putting themselves into pretzel positions rather than going and doing heavy deadlifts. Yeah.
Yeah, it's just depends where your priorities lie at certain stages, and sometimes you just get so focused into one area, and you never really, you never really can balance everything. I don't think it's very hard,
No.
but for me, that I guess part of getting a little bit older is that you just want your body to feel as good as it possibly can for as long as it can.
Yeah, and I think variety is important as well. You know, if you just focus on one thing too much, yeah, I think you're going to miss out on other benefits that all these various different aspects of health and movement and fitness have.
So one thing that is very visceral with your online posting is that the comment sections are usually hilarious for me. I think the comment sections of what you post, so you get quite a lot of bite back, like you said, and you've even mentioned it throughout this podcast. You get a lot of people coming at you, I guess, from just a pure human perspective. How do you deal with all of that online and it not start to taint your perspective of whether it's the industry, what you do, and kind of get caught up in those comment sections and the real aggression that can be in there?
Yeah, it's taken me a while to have this position and this thought, because it is something that didn't happen overnight. But I've realised that a lot of people, you know, they act differently on social media than they do or they would do in a face-to-face situation. And so I know a lot of people say things that they don't actually mean, and I've done it myself. You know, I've been in comment sections where I've been saying things to other people. I'm like, why are you doing this? Well, you wouldn't say this if you were sitting down across a table having a coffee with somebody. So why are you now deciding to say it this way on social media? So I think, you know, the way I dealt with it is I give people the benefit of the doubt. You know, I give them a pinch of salt. I just realise, you know, emotions can be high, particularly when, you know, beliefs and things are challenged. You know, there's often that adage, you know, people like to shoot the messenger rather than actually look at the message itself. So I just give people breathing space. I take breathing space myself. I now very much count to 10, sometimes 100, and don't respond straight away. But, you know, there's a line. I will still, you know, give people benefit of the doubt. But if after a while you realise, hold on a minute, yep, that person's had plenty of benefit of doubt now we're going to start having some debates and discussions. Yeah.
I think the fact, just the same with you and the same with you and Dan Van Zan, for example, everything you post will have a reference to it.
Yeah, but I think we also got to be a bit careful, because you see this also sometimes being used as a tactic by people.
That is true.
To fool people with misinformation as well, because evidence can be abused a lot, you know, because there is evidence out there on lots of stuff that is just stupid and bullshit. Because unfortunately the quality of evidence is something that a lot of people are unaware of. Just because it's got a citation number and it's on PubMed doesn't actually mean that it's actually true. So the critical thinking skills and the ability to, you know, critique and analyze research is also important to do. And I say, as much as I do like to see people using supporting evidence, you do have to engage your own critical thinking brains and go and fact check people. You have to go and look at that supporting evidence rather than just taking it as read as being true.
That is a really good point. I think it's very, very well said, because there are even some podcasts I've listened to where you've heard someone say a claim, and then you go and actually look at the study, and the claim they actually said was if they were reading a completely different paper. Like for basic stuff, it's like, there was this study done on 30 participants on
13 females, and it was 15 males.
It was all done on this, and you go, hold on, there was actually only 6 participants, and it is very, very true. You do need to fact check that. Okay, Adam, this has been great having you on, and I think there's some great stuff to go through there. I guess before we leave, I'm always interested in asking people what they are listening to, watching or reading that's maybe inspiring them at the moment.
Well, actually, at the moment, if I'm being honest, mate, my reading and keeping up to date with stuff has taken a bit of a back seat, because I've got some rather harsh life situations going on at the moment that's taken stage front and centre. So I actually, for the last sort of 6 months or so, have been focusing on my family life and other things at the moment, rather than keeping up to date with books and podcasts, if I'm being honest. But, there's lots of resources out there that I always try to point people towards that I do recommend. I've got some great colleagues, and we've mentioned, some of them, Mike Israel, Dan Van Zandt, Flexibility Research out there. There's lots of people out there that I think are doing great work to try to move things forward in the right direction.
Is there anyone we haven't mentioned that you really enjoy following at the moment?
Again, let me think. There's quite a few. I mean, I'm representing the T-shirt Barbell Medicine. I think they're a great group out there. They do some really good work. So that's Jordan Feigenbaum. I always mispronounce his last name, and Austin Baraki. So these are two American MDs who are into their weightlifting and powerlifting, and they're doctors who very much use exercise as medicine. And they've got a saying, no silly bullshit, as well. So yeah, I've got to give them a big shout out. They do some good work. So all the Barbell Medicine team, keep doing that stuff.
And where's the best place to send people to keep up to date with what you're doing, and maybe dive in that comment section as well?
Yeah, so I'm across all social media platforms. I'm on X, or Twitter as it used to be called, Instagram and Facebook. So those are the three that I use regularly. And it's either Adam Meakins, which is my name, or you can find me probably under The Sports Physio, which is my pseudonym.
Adam Meakins, thank you so much for coming on the show. I've loved it.
Appreciate it, Lewis. Thanks for the chat.
If you enjoyed that episode, then you might want to head over to this playlist right now, where we've curated some of the best episodes for you to get started with. So all you got to do, click there. Go on, click it, go.